Every 3 seconds, someone breaks a bone due to osteoporosis, and most never see it coming. Even at my hospital, we see patients with unexpected fractures every day. Osteoporosis affects over 10 million Americans, most of whom do not even know they have it until a fall or a fracture changes everything. But the good news, you can catch it early, reverse the risk, and strengthen your bones naturally. Hi all, Dr. Neha Garg here, a nephrologist and an integrative medicine physician. Today I'll show you how to detect early signs before a fracture happens, use functional medicine wisdom to rebuild bone strength, apply ancient Ayurvedic tips to stay strong. Stay with me till the end. I'll also share 5 subtle early warning signs of weak bones that most people miss. Osteoporosis literally means porous bones. Instead of hard, dense material, they become soft and spongy. As you age past 50 years of age, the odds of fracture, they start to go up. If you are a woman, there's 1 in 2 chance of osteoporosis related fracture. For men, it is 1 in 4. Every day in practice, I meet older adults who fractured a wrist, hip, or spine, sometimes just from a minor slip at home. Most say, I did not even fall that hard. But that's the point. Osteoporosis is like a silent thief. Hip fractures often lead to long-term disability, and many people never regain full independence after that. And here's the kicker. Most falls happen at home due to avoidable factors like dim lighting, slippery bathroom floor, loose rugs, or low furniture. Osteoporosis does not just happen in a day. It slowly builds up over years and decades as we get older. And here is what triggers it. Declining estrogen and testosterone levels, sedentary lifestyle, lack of sunlight, diets which are low in minerals and high in acid foods, vitamin D deficiency, chronic gut issues and poor absorption, and some other factors like prescription medicines such as steroids, immunosuppressants, blood thinners, and untreated thyroid issues. Ask yourself, do you feel that your legs are losing their strength? Do you have an unbalanced gait, and do you need support with your hands when you're standing up from a chair? Are you postmenopausal? Do you take steroids, blood thinners, or have thyroid issues? These might seem small, but these are red flags that your bones may be thinning. Now let's talk about what is needed to maintain bone health. Bone is a complex living tissue that is dependent on more than just calcium. So calcium-only supplements are not enough. You also need to add vitamin D, which is needed for calcium regulation, vitamin K, which also directs calcium into the bones and away from the arteries, magnesium and boron, they are needed for bone metabolism, and collagen to provide strength and structure. However, none of these supplements will work if your gut is inflamed. So you have to heal your gut first with prebiotics and probiotics, get treatment for leaky gut or celiac disease, and remove inflammatory foods first. All the women above the age of 65 years should get a DEXA scan, which is a bone scan for osteoporosis. You will need to do this earlier if you have other risk factors like smoking, frailty, or low body weight, long history of steroid intake, immunosuppressants, certain blood thinners, or a history of early menopause. Older men who also have these risk factors should also get tested with DEXA. If your DEXA scan shows bone loss, don't panic. Osteoporosis is very treatable. Partner with your doctor or functional medicine physician to get started on a personalized treatment plan. Medications can help, but lifestyle, nutrition, and gut healing are the game changers. Ayurveda sees osteoporosis as a state of vata imbalance, brittle, dry, degenerative state. Here's how to restore strength and balance naturally. Number 1 is with Abhyanga, which is a daily massage of your joints and long bones with warm sesame oil. Bone broth is considered an excellent supplement which provides calcium and collagen. For vegetarians, they can take moong dal soup or plant-based alternatives. Ghee is considered deeply nourishing for bones and joints. Ashwagandha and shatavari are two ancient herbs which are backed by modern research, but these should only be taken after consultation with your physician. Avoid cold drinks and extreme fasting, both of which aggravate the vata dosha and increase frailty. Your bones love movement, so build it into your daily routine. Weight-bearing exercises like walking, yoga, resistance training, and Tai Chi. 10 to 15 minutes of sunlight in a day for natural vitamin D production. And lastly, make your home fall-proof. Install grab bars, use night lights, remove loose rugs, wear anti-slip footwear at night. You don't have to wait for a fracture to happen. With the right nutrition, functional testing, and time-tested routines, you can rebuild bones naturally, holistically, and powerfully. Because strong bones is not just about health, it is about independence, preventing disability, and living vibrantly. Let me know in the comments what one thing you will start today for healthy bones. Follow Healthy Buddha for more tips on holistic health, and don't forget to like, share, and subscribe. Namaskar.